I became passionate about maternal health when I became a mom. I was interested in women's health for a long time and wellness generally, as a yoga practitioner and as an advocate in public health even prior to becoming a mom. But it was really that was the turning point, and that was because I had a complication. And that complication that I had was one that is one of the biggest killers of women in pregnancy and childbirth, and that's postpartum hemorrhage. So that's what really became the catalyst for my engaging on such a deep issue.
Why did you decide to make the film, No Woman, No Cry?
I decided to make No Woman, No Cry after I visited an amazing success story. It was a village in the highlands of Peru where they were able to reduce maternal deaths in half in less than 5 years. And everything I had read before that showed that this was difficult and that progress wasn't being made. And then I went to this CARE project and I saw that it actually was possible, and I saw how that was doable and how they were able to achieve those huge changes in the system. And they were, so many of them, very simple ones, simple ways to engage the community to come and use the resources that they had and to utilize services that were provided to them. And that was just by treating women humanely, really. In most cases, it was sort of understanding what those barriers to care were for them, and then trying to break those barriers down so that the clinic and the hospital seemed a much more a more welcoming place, and that was done in very simple, low-cost ways, and it made me feel that this was doable. And so I set out to make the film to show some of those kinds of success stories around the world.
Was there one thing that sticks in your mind during the filmmaking process? Was there that one surprising thing, that one big aha moment that you encountered?
There were so many aha moments in making this film. I mean, every woman that I met, and there's only a fraction of the stories that are actually in the final film, there are endless stories of women that will be with me forever. But I think that I walked away from most countries feeling that one of the biggest obstacles was really that transport, that women were so isolated in so many scenarios. Even if they were in a heavily populated urban area, they were still isolated from the kind of care that they should be able to access. And I think what I started to feel really was that it's really the healthcare workers, it's the people on the front lines that I think have the most knowledge about what the communities themselves need and what they want, and they're also the most willing to go out there and to do that. So I think I have more faith in healthcare workers than I ever did before. I know I do with my own team that saved my life, and it's very inspiring to see that level of commitment and dedication, even when people aren't compensated as they should be.
What is the one thing you want people to walk away with after watching the film?
Well, I want people to feel, even just for a few moments, that they were in the shoes of another woman, a woman that they may never meet, or in a country that they may never go to, but just to feel that connection, that sameness, because I want to take away the otherness of this happens to some people, but it doesn't happen to everyone. It shouldn't, the disparity should not be so great. And I think from what I've heard from people who have seen the film that they are able to do that. And then I hope that they will take that feeling and that connection and want to do something, that they'll feel emotionally connected, they'll understand the significance of how fortunate they are or were to have gotten through their own birth scenarios when so many women are not and are so unsupported in the world. I want us to really feel like we can become the support for all the women that don't have that support.
Can you tell us about Every Mother Counts?
Well, I started the Every Mother Counts campaign to sort of start off where the film leaves you, as a way to sort of engage you to the next level of interest. We actually launched some education modules today on our site, but we hope that it will be a resource for people who want to get more involved as advocates, but also as just concerned citizens. And then there'll be some action items that we'll hope to have when we're ready for our broadcasts, which will be different ways that people can engage in a meaningful way. I think different people have different needs or wants when they want to do something for an issue, and I hope to offer a few different kinds of options so that there's something for everyone, and that people feel that not only do I feel something for this, but I can do something. I can get together with my friends and I can help in some way. So we hope to give those kinds of actionable ideas.
So on this issue on maternal health, changing behaviors is sort of central to the issue. Without changing behaviors, you can't get to solutions. And on the website, you talk about change begins with you. Can you talk a little bit about that and what can each and every one of us do in our sort of small little ways?
I think we all have something that we can contribute in some way. Whether in the U.S., whether you are part of a community of moms, or you are a blogger, or you have, you work in a hospital, or you work in a school. I mean, we have resources, any one of us, that are so much more than so many women. And so to try to take a look at what do I have? We all have a different set of skills. We all have a different set of things we can contribute. And I think it's important for everybody to take ownership of what they have themselves, what each individual has that they can share. But I think it's possible for everybody to do something, even if it's just sharing the stories. That's the simplest thing you can do: is see the movie, tell your friends about the movie, share the website, show what you've done if you've made a contribution or a pledge of some kind, and encourage others in your community to do the same.
So a lot of our employees wanted to be here for your talk, couldn't. We have people in ECO, in India and China. So how will they get the chance to watch a film?
Well, the film has been touring for the last year to a lot of global health conferences. It was in India actually last summer. But I hope to continue bringing it around. I need to get it translated in a few more languages. But my plan is to, over the next few years, to really get it in as many languages and into as many countries. And universities, so we'll be doing that a lot in the coming year. But we have about 4 more years before the 2015 MDG date, and in that period of time we will be doing as much as we can to share the film, share our stories, and share even more stories as we continue to travel, to show people that there's a lot to be hopeful about, and that we can actually do this if we come together on this.